psychologist here at RVH. I'm here today to talk to you about different communication disorders after stroke. The first disorder we will be talking about is aphasia. We're going to learn what it is, how might it affect you, and what you can do to help with it. Aphasia means difficulty with communication. It is difficulty using or understanding language caused by damage to the brain. It can affect what we say, what we understand, our reading, and even our writing. There are two basic types of aphasia. The first is expressive. With expressive aphasia, you know what you want to say, but you have trouble getting the words out. Receptive aphasia is the opposite. You may not understand what people are saying to you, but you're able to talk with relative ease. One or both types of aphasia can be present in a stroke. Difficulties may be mild or can range from mild to severe. The first type of aphasia we're going to talk about is the fluent type of aphasia, or it's called Wernicke's aphasia. With this type, you may speak without hesitation, but the wrong words may come out. This may make you very difficult to understand. You may have difficulty also understanding what people are saying to you. An example of fluent aphasia, or Wernicke's aphasia, is as follows. The daughter is driving fast. He is raking on the chair. It looks like a dog is leaving off the table. Uh-oh, the sink is all over the cliff, and the father is wanting to the mall. Another type of aphasia, the more common type, is our non-fluent or Broca's aphasia. In severe cases of Broca's aphasia, you may only be able to get a few words out at a time. Your vocabulary may be very limited. You may be unable to understand quite well and read quite well, but again, your difficulties are in expressing yourself. Here is an example of a non-fluent type of aphasia. The mother, dishes, the sink, running over, the boy, he fall, the cookies reaching, little girl waiting. A third type of aphasia is called anomic aphasia. And anomic aphasia purely means difficulty naming objects, people, and other things. Usually, if you have anomic aphasia, you can understand and read well. Here's an example of anomic aphasia. The mother is at the, what's that called? The thing, the thing you wash dishes in. Anyways, the water is overflowing and she is making a big mess. The boy is standing on I know what that is. It's not a stump. It's not a chair. Well, it's like a chair. He's going to fall off it, and he's reaching for a cookie. So again, this person had difficulty just saying the names of objects. Now, global aphasia is the most severe type of aphasia, and it is the near or total loss of the ability to use language. Usually with global aphasia, you are unable to read, write, speak, or understand people. Now, Apraxia is another type of communication disorder. An apraxia of speech is a motor planning disorder. People with apraxia know what they want to say, but have difficulty coordinating the muscles in order to move our lips, our tongue, our jaw, the parts of our body to make speech. People with apraxia have trouble sequencing the sounds and syllables in words. If you have apraxia, you might also have difficulty using your hands to make gestures. We find with apraxia that automatic speech, or speech such as counting, singing, or songs, things that we do innately, are usually the easiest to do. So you might find that you're having difficulty talking, but you can count from 1 to 10 or sing O Canada with relative ease. Here's an example of apraxia. The mother is washing the dishes at the sink. The water is overflowing and she may slip. The boy is standing on a pool. stool, no, stool. He is about to fall over. The girl is wafting him. Now, apraxia is different from dysarthria. Dysarthria is a speech problem due to weakness, slowness, or poor coordination of the muscles used for speaking. You'll find with dysarthria that your speech sounds slurred and may be difficult to understand. Now, you'll notice with apraxia, the example I gave you before, overall you could understand me. But with dysarthria, all speech will be difficult to understand. So what help is available for people with aphasia and other different communication disorders? A speech-language pathologist, or an SLP for short, can work with you, your family, and hospital staff to facilitate and make communication easier and more effective. There are specific treatments available for specific difficulties. Now, I want you to know that communication is much more than just speaking. Communication also includes facial expression, gesturing, conveying emotion with different tones of voice, using different body language, writing and drawing. So just because you or your loved one is having difficulty with your speaking does not mean you cannot communicate. Sometimes what's offered to patients who are having difficulty communicating are pictograph topic pages or communication boards. And these can be a great resource for people to be able to point to tell them specific messages or tell their loved ones specific messages. These are available at our nursing station. If you need one or would like to see one, please ask a healthcare professional. So what can you do to help get your message across to the person who has aphasia? Well, the first thing to do is look directly at the person when speaking. You want to speak in an adult-appropriate tone of voice. Just because someone has aphasia or difficulty communicating, this does not mean they are any less intelligent than before their stroke, and therefore you should speak to them as if they're an adult. Nothing has changed. Make sure when you're communicating, though, you communicate one idea at a time. Try to keep your sentences simple. In order to help, also write down key words. This can help reinforce the message. And as I said, use nonverbal methods of communication, such as gestures and facial expression, to again get your message across. It's also helpful to use objects in the environment. If you see something that you want to describe as opposed to talking about it, show the person the object. It's also helpful to use yes or no questions. So for example, if you want to give someone a drink, ask them and give them a choice. Would you like apple juice? Yes or no? It also can help to draw simple pictures. So maybe you want to tell your loved one about your cat at home. Draw the picture of a cat in order to help reinforce what you're talking about. And the most important thing to remember is always acknowledge the person's competence. Start off by saying, I know you know. This will do a lot to empower the patient and also let them know that you know they are still as intelligent as before their stroke. Now, what can you do and what can you tell your loved one or patient in order for them to get their message across to you if they're having difficulties communicating? Encourage the person to write down anything they can. Even just a few letters down on a piece of paper can help get the message across. Also, encourage them to draw simple pictures. As I said, gesturing and pointing is very important. So, ask the person to point to something in the room or show me to get their message across. Usually when you're having a conversation, attempt to get the general topic down first, then move on to the details. So for example, if you wanted to talk about, or your patient wanted to talk about how your daughter is doing in math class, first, maybe talk about school or get them to identify school. And then from there, narrow it down to the different subjects and then your patient can identify, oh, math, that's the one I wanted to talk about. So start general and then move more into more specific details once the general topic is identified. Again, having a resource like a yes-no board can be very helpful. Again, at our interprofessional nursing station, we have many yes-no boards that you can ask for. Encourage your patient or loved one to point to yes or no if they're having trouble getting the words out. If realistically you do not have time to communicate with a patient, because when people have communication disorders, it does take extra time in order to, a simple conversation that maybe before their stroke can now take up to 10 minutes. But it's important to explain to them that if you don't have time right now, that you'll return when you do, and that what the person has to say is very important. The worst thing you can do is pretend to understand the person when you don't. That can be very demeaning, and usually the person will know that you don't understand. I hope I've been able to shed some light on communication disorders after stroke. If you ever have any questions, please feel free to contact the speech-language pathologist on your floor or any healthcare professional. Thanks and have a great day.